It's amazing when you think about it. Our brains and nervous systems, they're running the show for everything we do. And most of the time, we don't even have to give it a second thought.
Right. It's all just happening behind the scenes.
But then, when you try to imagine how doctors actually figure out what's going on with this incredibly complex system, it can feel pretty overwhelming. All those tests, all those procedures. So if you've ever felt a little lost when it comes to neurological assessments, whether you're actually getting ready for one or just curious like me, you're in the right place.
Totally. And for this deep dive, you send over some really interesting excerpts from a chapter all about the neurologic system.
Yeah, you had some great stuff.
Our mission today is to break down the most important parts of that material to really make these assessments not just clear, but something you'll actually remember, and maybe even learn something surprising along the way.
I love that. It's like getting a peek behind the curtain to see how these assessments work and why they matter. We're not just going to list things off, we're going to get into the why.
Yeah.
So why don't we start with something everyone has heard of, the cranial nerves. There are 12 of them, right? Each with a special job to do.
That's right. These 12 nerves, they come directly from the brain or brainstem, and they control very specific things, mostly in the head and neck. By checking each one carefully, doctors can get a really good idea of how different parts of the nervous system are working.
It's wild to think that something as basic as smell can tell us about the nervous system. The first one, CNI, that's the olfactory nerve, and it's all about our sense of smell. And the assessment is pretty straightforward. Can you identify familiar smells like coffee or vanilla with your eyes closed?
Exactly. But here's the thing. While losing your sense of smell for a little bit is common if you have a stuffy nose, a long-term inability to smell, doctors call it anosmia, can sometimes be an early sign of a problem, like something affecting the frontal lobe of the brain or even certain neurological conditions that impact the olfactory bulb, which is the part of the brain that processes smell.
So even a simple smell test can be a big clue.
They really can.
Okay, so next we have CN2, the optic nerve. And this one is obviously critical for vision. I think we all know the classic eye exam with the Snellen chart.
Yeah, that one's pretty familiar.
But what else is involved when they routinely check this nerve?
Well, besides the Snellen chart, which measures visual acuity, or how clearly you can see, clinicians routinely do something called a confrontation test.
Okay, I'm not sure I've heard of that one.
It basically checks your visual field, so it's looking at how much you can see to the sides in your peripheral vision without moving your eyes. Changes in either visual acuity or visual fields can be early signs of pressure on the optic nerve or problems with the visual pathways in the brain.
So they're looking for blind spots or areas where your vision is blurry.
Exactly.
Okay, that makes sense. Now the next three, these are the oculomotor, trochlear, and abducens nerves, CN 3, 4, and 6. These all seem to work together to control how our eyes move and even the size of our pupils.
You got it. They're all very connected. The oculomotor nerve, that one handles most eye movements, pupil constriction, and even lifting the eyelid.
It does a lot.
The trochlear nerve, it's mainly responsible for moving the eye downward and inward. And the abducens nerve that controls outward or lateral eye movement.
So because they all work together, I'm guessing that's why they're usually assessed together.
Yeah, exactly. Because problems with these nerves often show up in similar ways, like double vision or trouble moving your eyes smoothly. They're usually checked at the same time. The doctor will look at pupil size and how they react to light. And they'll also have you follow a moving object with your eyes to see how well they track in different directions.
So if you can't follow that object smoothly, or if your pupils don't react normally, that could point to an issue with these nerves.
Right. Those kinds of deficits are often a sign of problems in the brainstem or with the nerves themselves.
Okay, moving on to CNV, the trigeminal nerve. It sounds like this one covers a wider range of things.
It does. It has 3 main branches, and it handles both feeling and movement in the face.
So is both sensory and motor.
Exactly. To check the sensory part, the doctor will test for light touch and pain sensation on different spots on your forehead, cheek, and jaw. And for the motor function, they'll ask you to clench your jaw. That tests the muscles you use for chewing, which are controlled by this nerve.
Interesting. So it's really important for a lot of basic functions in the face.
Oh, absolutely.
Okay, then we have CN, the Evan, the facial nerve. This one, whenever I hear about it, I always think about facial expressions.
That makes sense. It controls most of the muscles we use to make those expressions, like smiling, frowning, puffing out your cheeks, even raising your eyebrows.
So why is it so important, neurologically speaking, to check things like our smile and frown?
Well, by routinely checking facial strength, so looking at those movements you mentioned, doctors can quickly spot any weakness or asymmetry.
Like if one side of your face droops.
Exactly. And that can be a sign of different neurological conditions, including things like stroke or Bell's palsy,
Wow. So a simple smile can tell you a lot.
more than you might think.
Let's move on to CN at 8th, the vestibulocochlear nerve. This one is all about hearing and balance.
It is. And hearing is routinely checked, often with a simple whisper test. The examiner will whisper a word or phrase near each ear, and you just have to repeat what you hear.
Makes sense. And what about balance? How is that typically assessed?
Well, balance can be evaluated in more detail, but a quick check might involve just observing how you walk. Or, as the material mentioned, they might do the Romberg test, where you stand with your feet together and your eyes closed to see if you can stay balanced.
Ah, I've heard of that one.
If you have trouble with hearing or balance, it could point to a problem with the inner ear or with the vestibulocochlear nerve itself.
So we've talked about the cranial nerves that are routinely checked. What about the remaining ones? CNIX through 12.
Well, they might not always be part of a routine assessment, but they're still really important.
Of course. So what do they do, and how might they be checked if needed?
Okay, so CNIX, that's the glossopharyngeal nerve. It's involved in swallowing and taste, specifically on the back of the tongue. So to check it, a doctor might test your gag reflex or see if you can taste bitter things.
That makes sense. And CNX, the vagus nerve.
This one is a busy one. It has a ton of functions like swallowing, speech, even regulating your heart rate. To assess it, a clinician might listen to the quality of your voice or watch you swallow.
Wow, so many things.
I know, right? Then there's CNAI, the accessory nerve. It controls muscles in your neck and shoulders. So to test it, they'll have you shrug your shoulders and turn your head against resistance, seeing how strong those muscles are.
Okay, and finally, CN12, the hypoglossal nerve.
This one controls tongue movement, so the assessment is pretty simple. Stick out your tongue, move it from side to side. If there's any weakness or it deviates to one side, that could signal a problem with this nerve.
It's like a super detailed map of the head and neck.
I like that analogy.
So let's switch gears a bit and talk about stroke assessment. This is an area where quick recognition is absolutely crucial. And the acronym FAST, I think most people have heard of that.
Yeah, it's well known for a reason. FAST is such an important and easy to remember tool for recognizing the early signs of a possible stroke. And the reason it's so important is that acting fast can really make a huge difference in how well someone recovers.
Absolutely. Every minute counts.
Exactly. So let's break down FAST. F stands for face drooping. You ask the person to smile and look for any asymmetry, like if one side of the face is drooping.
Right. A is for arm weakness.
Yes, you ask them to raise both arms and see if one arm drifts downwards. S is for speech difficulty. So you have them repeat a simple sentence and listen for any slurring or strange speech patterns.
And T stands for time.
Yes, time is critical. This part emphasizes how important it is to call emergency services immediately if you see any of these signs.
If you can recognize those signs quickly, it can drastically increase the chances of a good outcome.
It can be life-saving.
Now, you also share some information about risk factors for stroke. And knowing these feels really important for prevention.
Absolutely. Some of the major risk factors are advanced age, high blood pressure, smoking, diabetes, heart disease, and having a personal or family history of stroke or what's called a transient ischemic attack or TIA.
And we can't forget obesity.
Right, that's a big one too. Being aware of these risk factors can encourage people to make healthier lifestyle choices and take preventive measures early on.
And hopefully lower their risk.
Exactly.
So we've talked about the FAST assessment, which is the initial check. But then there's a more detailed evaluation called the NIH Stroke Scale, or NIHSS. What does this tell doctors?
So the NIHSS, that's a standardized, much more comprehensive exam that's used to really quantify or put a number on the neurological deficits someone might have after a suspected stroke.
So it's getting a much more detailed picture.
It is. It looks at several key areas, including level of consciousness, eye movements, visual fields, facial symmetry, motor strength in the arms and legs, sensory perception, coordination, speech, and even something called neglect.
Neglect, what's that?
It's a lack of awareness of one side of the body. This detailed scoring system helps doctors determine how severe the stroke is, guide treatment decisions, and track the patient's recovery over time.
So FAST is like the initial alarm, and the NIHSS is the in-depth investigation.
I like that. A good way to think about it.
Okay, let's shift gears again to another important neurological area, Alzheimer's disease assessment. The early signs that were mentioned in the material, They seem like things you could easily miss or just chalk up to normal aging.
Yeah.
What are the things that really make them stand out?
That's a really important point. While it's normal to be forgetful sometimes or to have some mild cognitive changes as we get older, the early signs of Alzheimer's are usually more pronounced. They happen more often, and they start to interfere with daily life.
They're not just occasional slip-ups.
Exactly. So some key indicators are memory loss that affects daily activities, especially difficulty remembering things you've recently learned. Also, frequently struggling to find the right words, being confused about time or place, and having impaired judgment.
So it's a noticeable decline from how someone used to function.
Exactly. And there are specific tools to assess these areas, like the Mini Mental State Exam or MMSE.
Who does that involve?
The MMSE is a questionnaire, just 30 questions, and it gives a general overview of someone's cognitive function. It looks at different things like their orientation to time and place, attention and concentration, short-term memory and recall, language abilities, and basic visual spatial skills like copying a simple drawing.
So it's a screening tool to get a sense of their overall cognitive abilities.
Yeah, and it's also useful for tracking changes in cognition over time.
Now, I also saw the Montreal Cognitive Assessment, or MoCA, mentioned. How is that different from the MMSE?
The MoCA is generally considered to be more sensitive, especially at picking up milder forms of cognitive impairment. This can be really important for catching things like early Alzheimer's or other neurodegenerative conditions.
So it's casting a wider net, so to speak.
You could say that. While it also looks at a lot of the same things as the MMSE, it includes some tasks that are a bit more challenging.
So it's pushing a little harder.
Right. It specifically targets executive functions, which are things like planning, organizing, and switching between tasks. And it also has more in-depth assessments of attention, concentration, memory, language, and what's called visuoconstructional abilities.
I'm guessing that's the ability to put things together visually.
Exactly. Because the MoCA includes tasks that assess planning and organization, it can help clinicians detect very subtle cognitive decline, stuff that might be missed by more basic assessments.
So it's a valuable tool for early detection.
It really is.
The last assessment for Alzheimer's that we wanted to talk about is the clock drawing test.
Ah, yes. The clock drawing test.
It seems incredible that drawing a clock can reveal so much. What kinds of mistakes would be red flags for doctors?
It might seem simple, but it's actually assessing a whole range of cognitive functions, especially what we call executive function, which involves planning and organizing, as well as visual spatial abilities and how well all these cognitive skills work together.
So it's not just about being able to draw.
Right. Some red flags might be things like having trouble placing the numbers correctly, like omitting numbers or putting them outside the clock face. Also, not being able to draw the hands to the right time, or even just drawing a circle that's misshapen or incomplete.
So even subtle errors can be significant.
They can. These kinds of mistakes can point to problems with executive function, visual perception, and motor planning, all of which can be affected by cognitive impairment.
It's fascinating how interconnected everything is. Okay, let's move on to how we assess our sense of touch and feeling, what's called sensation assessment. It sounds like there are different types of sensation that are checked, and each one tells us something specific.
Absolutely. Sensation assessment is all about evaluating how well the different sensory pathways in your nervous system are working. And the material highlighted several key types.
What are they?
One is light touch. They often test this by gently stroking the skin with a cotton swab on different areas like your face, arms, and legs. This is checking the superficial touch receptors and the pathways they use to send signals to the brain.
Is making sure those signals are getting through.
Exactly. Then there's pain and temperature sensation. These are usually assessed together. They might use a sharp or dull object to see if you can tell the difference. And they'll also apply something cold or warm to test your temperature sensitivity.
So they're checking different types of nerve fibers.
Right, because pain and temperature signals travel along different pathways than light touch.
Okay, and then there's the sense of vibration. This is often checked with a tuning fork, right?
That's right. When you place a vibrating tuning fork on a bony prominence like your wrist, elbow, ankle, or toes, it tests your ability to feel those vibrations.
What does that tell us?
This type of sensation travels along specific, larger nerve fibers and pathways. So if someone has trouble feeling the vibrations, it could be a sign of problems with these deeper sensory pathways, often associated with conditions like neuropathy.
Interesting. What about proprioception? That's our awareness of where our body is in space.
Right. It's sometimes called position sense. They usually test this by having you close your eyes, then they'll passively move one of your fingers or toes up or down and ask you to tell them which way it moved.
So you have to sense it without seeing it.
Exactly. This tests the sensory receptors in your muscles and joints, which are constantly sending information to your brain about the position of your limbs. It's super important for things like balance and coordination.
Makes sense. Finally, there's two-point discrimination. That sounds like a pretty precise test.
It is. This one assesses your ability to distinguish between 2 points of touch that are very close together on your skin. They'll use a special tool with 2 adjustable points, and they keep moving the points closer until you feel just 1 point.
So how well you do depends on how sensitive the skin in that area is.
Right. Different parts of your body have different densities of sensory receptors, so your ability to discriminate will vary.
So it's like a map of your tactile sensitivity.
Exactly. And it gives doctors information about how well the part of your brain that processes touch, the somatosensory cortex, is working.
It's amazing how much information you can get from these different types of tests. Okay, the last area we wanted to cover is reflexes, specifically in the lower extremities. We all know about the knee-jerk reaction. But what do these reflexes really tell us about the nervous system?
Reflexes are involuntary muscle contractions that happen in response to a specific stimulus, and they can tell doctors a lot about the health and function of specific parts of the nervous system, especially what's called the reflex arc.
It involves.
It involves sensory and motor neurons, as well as the spinal cord. So the patellar reflex, or the knee jerk, that's the one where they tap on the patellar tendon just below the kneecap. And the normal response is that your lower leg extends.
Your knee jerks.
Exactly. This reflex primarily assesses the integrity of the L2, L3, and L4 spinal nerve roots.
Okay, and then there's the Achilles reflex, which is the ankle jerk.
Yep, that's the one where they tap on the Achilles tendon at the back of your ankle. And the normal response is plantar flexion of the foot, which means your foot points downwards. This one mainly involves the S1 and S2 nerve roots.
Got it. And then there's the plantar reflex, which I've heard is also called the Babinski sign. I think this one is different in adults versus babies.
You're absolutely right. For the plantar reflex, they stroke the sole of the foot with a blunt object. In adults, the normal response is that the toes curl downward, but if the big toe flexes upward and the other toes fan out, that's called Babinski sign, and it can be a sign of a problem.
What kind of problem?
It can indicate dysfunction in the upper motor neurons, which are the pathways connecting the brain and spinal cord to the muscles.
So it's a sign that something's not communicating properly.
Right. But here's the important thing, as the material pointed out, Babinski sign is actually normal in infants.
Because their nervous systems are still developing.
Exactly.
That's a good thing to remember. Finally, there's clonus. What is that exactly?
Clonus is basically a more exaggerated reflex. It's characterized by rhythmic muscle contractions that happen when a muscle is suddenly stretched. So to test it in the lower extremity, they would quickly dorsiflex the foot, which means they bend it upward at the ankle and then they hold it in that position. If clonus is present, the foot will make these rhythmic beating or shaking movements.
Like it can't hold still.
Right. And this usually indicates neurological impairment affecting the upper motor neuron pathways.
So again, it's a sign that something's not quite right with the communication between the brain and the muscles.
Exactly.
It's pretty incredible when you think about all the different ways there are to assess the nervous system, from these very specific reflex tests to the broader cognitive evaluations.
It is, and it really highlights how complex and interconnected the system is.
So to sum up, the neurological assessment is this really comprehensive and systematic approach to evaluating how well this incredibly intricate system is functioning. Each piece of the assessment adds to the overall picture, helping clinicians understand, diagnose, and manage a wide range of neurological conditions. Well said. So for everyone listening, we hope this deep dive has shed some light on neurological assessments. We've tried to highlight the key parts and logic behind these evaluations.
And hopefully you now have a deeper appreciation for the thoughtfulness and precision that goes into understanding how the brain and nervous system work.
And here's something to ponder as we wrap up. Given all the incredibly detailed ways we can assess the nervous system, from something as subtle as the smell test to something as specific as a reflex evaluation, what does this tell us about the delicate balance that's required for healthy neurological function? And what are the small, everyday habits that we can do consistently to maintain that balance over the long term? It's definitely something worth thinking about.
It is. It really is.
Thanks for joining us for this deep dive.
It was a pleasure.
Until next time.
See you then.